Okay, dah.
Tak apa. Okay, dah. Okay, 1, 2, mula. Assalamualaikum warahmatullahi wabarakatuh. So this is the case study for pharmacology. Next. So this is the flow for today's presentation. Next. So we will start with patient's background check. Next. The first one is age. The man is 69 years old, which also defined as elderly. So elderly may also define as senior citizen, which is still an arguable term as no clear definition of the term elderly. But most ages 60 and above, and usually retired from their professional works while experiencing decline in health and psychological state, etc. Next. So the relationship between increasing age and the immune system, the effects of aging on the immune system rest at multiple levels, which include reduced production of B and T cells in bone marrow and thymus, as well as diminished function of mature lymphocytes in secondary lymphoid tissues. They also don't respond well to vaccines, which is when you're older, you make fewer T cells, which attack other illness-causing cells, and most vaccines require new ones to work. And as a result, elderly individuals do not respond to immune challenge as robustly as the young. Next. So background number 2 is unhealthy lifestyle. So the man is a heavy drinker and a smoker, which correlate with substance abuse. So substance abuse is when we take drugs that is illegal, and also when we use alcohol, prescription medicine, and other legal substances too much or in the wrong way. Alcohol affects everyone differently, but if we drink too much or too often, our chance of injury or an accident goes up. And heavy drinking also causes liver and other health problems or can lead to more serious alcohol disorder. And smoke contains tobacco, which contains nicotine, an ingredient that can lead to addiction, which is why so many people who use tobacco find it difficult to quit. There are also many other potentially harmful chemicals found in tobacco or created by burning it. Next. So how that correlates with increased risk of heart disease. So chemicals in cigarette smoke cause the cells that line blood vessels to become swollen and inflamed. This can erode the blood vessels and can lead to many cardiovascular conditions such as atherosclerosis. And regular or hard alcohol use can hurt your heart and lead to diseases of the heart muscle called cardiomyopathy. Drinking alcohol regularly can also raise our blood pressure, and binge drinking can also cause irregular heart rhythms called arrhythmias. So that's it for me.
Okay, so the next one, we know that the medical history of our patient, he got the hypertension, osteoarthritis, and diabetes mellitus, and for my part is the hypertension. Next slide. So the blood pressure, we all know that it is the force exerted by the circulating blood against the walls of the body's artery, which is the major blood vessels in the body, and it can be written as two number, which is the first one systolic number that represent the pressure in the blood vessel when the heart contracts or beat, and the second diastolic number represent the pressure in the vessel when the heart rests between beat. Next slide. So high blood pressure is a common condition in which the long-term force of the blood against your artery wall is high. So as I mentioned before, blood pressure is determining both the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. So the more blood your heart pumps and the narrower your arteries, the higher your blood pressure is. Next slide. Okay, so this is the blood pressure category. You can see the hypertension stage 1 and hypertension stage 2 in the red column. Next slide. So the risk factor of the heart can be divided into two, which is the grey one is the non-modifiable risk, blue one is the modifiable risk. For the non-modifiable risk, it is the family history, age, rate, and the certain chronic condition. And for the modifiable risk factor, it is the unhealthy diet, physical inactivity, stress, and consumption of tobacco. And so for our patient, it is the certain chronic condition, the age, and the consumption of the cigarette and the alcohol. Next slide. Medication that doctor always use to treat hypertension. The red one is the common one, and the blue one is the additional medication that has been used. So for the two receptor blockers, angiotensin converting enzyme inhibitor, diazide diuretics, and calcium channel blocker, and for the additional medication blockers, beta blockers, allosterone antagonists, and many more. So which is the teacher with 60 years old have been prescribed with a calcium channel blocker of nifedipine. So let us find out more about the nifedipine. Next slide. Nifedipine, we know it is to treat hypertension, vasospastic angina, chronic stable angina. So it is the calcium channel blocker. So for the mechanism of action of nifedipine, it is blocking the voltage gate L-type calcium channels in the vascular smooth muscle and myocardial cell. So this blockage prevents the entry of calcium ion into cells during the depolarization. So if you have a high blood pressure, it works by blocking calcium going into muscle in the heart and blood vessel. So muscle need calcium to contract. So when you block the calcium, it make the muscle cell relax, and this lower your blood pressure and make it easier for your heart to pump blood around your body. So basically, nifedipine allows the blood vessel to relax and expand slightly, letting the blood flow through more easily. Next slide. So the doses of nifedipine, it can be divided into two, which is a short-acting capsule and the long-acting capsule. But it have the starting dose and the maximum dose. So for the starting dose, it will start with the lower doses, and for the maximum dose, it will increase to more than total of 80 milligram or 90 milligram per day for the long-acting, and the total of 60 milligram per day. So for the side effect, we all know that like all medication, nifedipine can cause side effects. So although not everyone will get them, so this is the common side effect, which is the headache, dizziness, flushing, constipation, and pounding heartbeat. And for the serious side effect, which is you need to stop taking the nifedipine and tell the doctor straight away, which is the yellow skin and white parts of your eyes turn yellow. This can be the sign of liver problem. And for the chest pain, it doesn't matter is it is a new or worse because this side effect needs to be checked out, as a chest pain is a possible symptom of a heart attack. And for the rare side effect is the allergic reaction for the nifedipine. Thank you.
Okay, now we're going to look about other medical history, which is osteoarthritis. Next. Osteoarthritis is a long-term chronic disease characterized by the deterioration of cartilage in joints, which results in bone together and creating stiffness, pain, and impaired movement. The disease most commonly affects the joint in the knees, hands, feet, and spine. Next. This is the pharmacology therapy for osteoarthritis. It is directed towards symptom management and pain control. For initial analgesic therapy is acetaminophen, and then non-selective NSAIDs, which is non-steroidal anti-inflammatory drugs, for example, diclofenac. The maximum dose for diclofenac is 100 mg daily, and then opioids and intra-articular corticosteroid. Last but not least, glucosamine and chondroitin. Next. The mechanism of action of diclofenac, it will inhibit the cyclooxygenase 1 and cyclooxygenase 2. Besides, it will also inhibit the thromboxane prostanoid receptor and lipoxygenase enzyme. The result from the inhibiting thromboxane prostanoid receptor, it will affect the arachidonic acid release and uptake. This mechanism of action will inhibit the transmission of pain to the brain. Next. Okay, this is the uses and the side effects of diclofenac. Diclofenac is used as a treatment for some diseases such as osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, and dysmenorrhea. The risk of diclofenac may occur in early treatment or may increase with the duration of use. First of all, it will increase the risk of serious cardiovascular thrombotic events, and it will cause a disease such as myocardial infarction. Next, it can increase the risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation in stomach or intestine, and it will cause kidney and liver problems. That is all for me. Thank you.
Okay, for next part, the teacher is actually suffer with diabetes mellitus type 2. Next slide. So, what is diabetes type 2? This is a chronic medical condition where the glucose level is higher than the normal state, and the insulin hormone is not enough to maintain the glucose level in body. This will obtain when a person is not practice healthy lifestyle or genetic or maybe next slide. Alright, so he suffered from chest pain or angina. Uh, this is where the symptom feeling discomfort because of heart muscle do not enough get oxygen rich blood. So there are four types of angina. Number one is stable angina, which heart work harder than this usual. It will last for 5 minutes, and then for unstable angina, it will last longer than 5 minutes. For microvascular angina, it is will last longer than 10 minutes and can lead to fatigue, low energy, and sleep problems. So for variant angina, it is a rare condition, and it happen when the spasm occurs in coronary artery. And for the medication to treat this symptom, first is aspirin, second is nitrate, and the third one is statin. So when all this medication is not work, so doctor will give you ranolazine. Next slide. So for this part, hospitalization, the vital signs, next. And this is a comparison between the teacher and the normal elderly. So basically, his temperature is quite normal, 36.4, and for the blood pressure, he suffered with hypertension, which is 160 per 80 millimeter per mercury. So for heart rate, it is quite normal, 75 from the reference, and respiratory rate it is 15, which is normal. And for the disease, he got hypertension and diabetes type 2. And for his sneeze condition, it is quite normal for elderly suffer with arthritis. Thank you.
So now we will move on to the next part, which is aspirin, which is administered due to the chest pain suffered from the patient. So what is aspirin? So aspirin, for the chemical name, is acetyl salicylic acid. It is classified as a non-steroidal anti-inflammatory drugs or NSAIDs. So for the doses taken for the aspirin is varies, but it ranges between 50 until 6,000 milligram daily. And then for the administration, it is administered orally. So for the mode of action, it is a non-selective cyclooxygenase inhibitors. So basically, aspirin is an anti-inflammatory and antipyretic drug which can relieve fever, inflammation, also pain. And also, aspirin is an antiplatelet drug which can cure myocardial infarction. Next, we will go through the mechanism of action for aspirin, whereby aspirin will inhibit the cyclooxygenase, which is an enzyme that will prevent the substitution from the arachidonic acid into prostaglandin H2, and this prostaglandin H2 will further substitute into prostaglandin F2 alpha and E2 as well as thromboxane. So because of the aspirin, all these effects in the blue box will be inhibited. So in the trigger, it mentioned that because of the administration of aspirin, the other drugs such as nifedipine and diclofenac was stopped. So why is that so? Because of if aspirin is administered with nifedipine, it will cause the increase in blood pressure. And while if aspirin is combined with diclofenac, it will cause the increase the risk of developing gastrointestinal ulcers and bleeding, as both of these drugs are non-steroidal anti-inflammatory drugs.
So I will continue about the ECG. So ECG is the next. ECG is the electrocardiogram or electrocardiogram. As based on the image, you can see there is P wave, PR segment, PR interval, QRS complex, QT interval, ST segment, and T wave. These are all the components in ECG. Next. So what is ECG? ECG is a test that measures the electrical activity of the heartbeat, and it helps to record the electrical activity of the heart, including the timing and duration of each electrical phase in heartbeat. Next. So the purpose of ECG is to first determine that heart attack has occurred and to help predict if a heart attack is developing, and also to monitor changes in heart rhythm. So in ECG we measure the time intervals and also the amount of electrical activity passing through the heart muscle. So by the time intervals, we can determine how long electrical wave pass through the heart and show the pattern of electrical activity, either normal or slow, fast or irregular. So by measuring the amount of electrical activity passing through the heart muscle, it can help to detect certain part of heart that are maybe too large or maybe are overworked. Next. In the fila, we mentioned also the heart muscle which does not pump blood as well as it should. And there are several diseases that become factors which trigger the heart failure. For example, coronary heart disease and high blood pressure, which cause the heart become weak or stiff to which disturb the blood circulation. Next is diabetes and obesity. And there are also heart failure. Not all conditions are irreversible, and practicing healthy lifestyle will help to reduce risk of heart failure. That's all.
So, after listening to all the medical histories and signs, according to the trigger, he actually has a myocardial infarction, which is the medical term for heart attack. Next slide. The myocardial infarction occurs when blood flow decreases or stops at a certain part of the heart, resulting damage to the heart muscle. This is due to the lack of oxygen delivery to the myocardial tissue. Next slide. Okay, on top of that, there are a few risk factors that leads to myocardial infarction. One of the primary risk factors is hypertension, as hypertension is associated with the development of atherosclerosis, which will interrupt blood flow through the heart muscle. Eventually, it will lead to a heart attack. Okay, the next one is diabetes mellitus. People with diabetes, particularly type 2 diabetes, are at increased heart attack because they usually have other conditions that contribute to cardiovascular disease. This includes high blood pressure, excessive LDL in the bloodstream, and also high triglycerides. Another risk factor is osteoarthritis. Osteoarthritis is commonly associated with myocardial infarction because of the high cholesterol and diabetes, along with reduced physical activity and the use of NSAID. For inflammation, osteoarthritis is not considered as an inflammatory disease. Some research show that osteoarthritis does involve inflammation, and long-term inflammation contributes to cardiovascular disease. Next slide. Okay, we move on to the genetics factor. Family history of myocardial infarction, particularly if one has a first-degree relative, either male or female, increases a person's risk of myocardial infarction. Okay, the risk of having a myocardial infarction also increases with older age. The majority of people who die of coronary heart disease are 65 or older. While men have a greater risk of heart attack than women do, women are at greater risk of dying. Okay, another risk factors including obesity, metabolic syndrome, stress, and unhealthy lifestyle. In this case, this man is a heavy smoker and also heavy drinker. Yeah, I pass to the next person.
So next, we continue with the medication of myocardial infarction. So the first one is thrombolytics. So this drug, also called clotbusters, help dissolve a blood clot, blocking blood flow to your heart. So the earlier you receive a thrombolytic drug after a heart attack, the greater the chance you will survive. Next is antiplatelet agents. So emergency room doctors may give you other drugs known as platelet aggregation inhibitors, such as aspirin. So as Teacher Shakira had mentioned earlier, we know the teacher be given aspirin too, right? So next medication is blood injection, such as heparin. So this to make your blood less sticky and less likely to form clots. Next medication is pain relievers. So you might be given a pain reliever such as morphine, cough, of course, to release pain. Nitroglycerin, and so this nitroglycerin belongs to a class of drug called vasodilators. So this medication works by relaxing the smooth muscle and blood vessel in your body. Next, ACE inhibitors. So this drug lower blood pressure and reduce stress on the heart. Next is statin. So this drug help control your blood cholesterol. So let's do beta blockers, also known as beta adrenergic blocking agents. So blocking the effects of the hormone epinephrine. Next slide. So let's discuss Further, how do beta blockers work for myocardial infarction? So beta blockers work by reduction of oxygen consumption of the myocardium by lowering the heart rate, blood pressure, and myocardial contractility. They also play an important role in reduction of reinfarction and complex ventricular arrhythmias. So these agents are recommended to be given orally within the first 24 hours. The preferable three drugs include metoprolol, carvedilol, and biprolol. So all these drugs proven to reduce mortality in heart failure patients. Next slide. In addition, beta blockers should not be given intravenously in patients with evidence of low cardiac output state and should be used with caution in elderly patients or in individuals with an unknown left ventricular ejection fraction. So this agent should also not be given to patients who have a contraindication to beta blockers. So to conclude, beta blockers are effective in the treatment of myocardial infarction. So next slide. So how is acute myocardial infarction diagnosed? So to determine whether you have heart attack, the first thing first, your doctor will listen to your heart to check for irregularities in your heartbeat. And then they may measure your blood pressure as well. Then, if they suspect that you have a heart attack, your doctor will also run a number of different tests. So the first test is ECG. So this may be done to measure your heart's electrical activity. Next is blood test. So this can also be used to check for proteins that are associated with heart damage, such as troponin. Other diagnostic tests include a stress test to see how your heart responds to certain situations, such as exercise. And next is angiograms with coronary catheterization to look for areas of blockage in your arteries. So the last test is an echocardiograms. So these help identify areas of your heart that are not working properly. So I think that's all from us. Thank you.